Furniture and Accents going out of business, liquidation in Monroe.
Welcome back. We're focusing on your medical questions today on Ask the Expert. We have Dr. Jeffrey Moore here with us to answer some of your questions. Doctor, thanks so much for being with us this afternoon.
Yeah, no problem.
Well, the first question we have for you, Dr. Moore, says, I've been having trouble with my teenage son vaping. Can this have any effects on the heart?
Yeah, so that's something that's come up a fair bit, just because how vaping has become so prevalent, unfortunately, in our society. You know, recent data suggests that 1 in 20 Americans have been using vaping or e-cigarettes, whatever you want to refer to them as, too. So we've been taking a deeper look into the potential cardiac effects of this as well, too. And unfortunately, this really hasn't proven a whole lot safer than regular cigarettes from a cardiac perspective. You know, studies have shown that these patients that do regular vaping or e-cigarettes have a much higher risk of coronary artery disease, which is by far and away the leading cause of heart attacks. The studies show that people that do vape have a 55% more likelihood of having a heart attack. It can also, in our young teenagers, cause tachycardia, which may predispose them to arrhythmias. Even underlying healthy teenagers that might not be aware of any known cardiac issues. You know, from a non-cardiac perspective, it's also known to cause depression, which we know is a problem in our teenage population.
All right, good to know. And the next question we have for you here, doctor, says, I've heard about fetal alcohol syndrome in mothers who drink, but is there any risks with fathers who use alcohol around conception?
Yeah, so this actually was just recently looked at. There was a study in Europe that looked at this and found that there was actually a significant link between fathers' alcohol use and congenital heart defects or problems with the heart. You know, is specifically fathers who used either heavy and regular alcohol use or a lot of alcohol use around the time of conception. And this seemed to contribute to the cardiac anomalies that the baby was born with. So really the best thing is if you or your partner are planning on having a baby, you want to do your best to limit alcohol intake around conception and certainly in the mother while she is pregnant.
Okay, doctor, thanks so much. And the last question we have for you here says, all of my kids use the FisherPrice Rock and Play, and I now hear they're being recalled. Is this a real threat or overkill?
Yeah, so unfortunately, the data has now proven that these rockers are really unsafe for babies to sleep in. You know, I have 2 children myself, both had bad colic, bad reflux, so I did use the Rock and Play. It was a lifesaver for me. But unfortunately, these Rock and Plays have been attributed to almost 60 baby deaths throughout the nation, and mainly because of the angle at which the babies sleep. Those rockers are kind of with a 30-degree angle, and babies don't have the same neck tone, thicker necks, and therefore are more likely to close off their airway due to that angle which they'd potentially be sleeping. Really, the American Academy of Pediatrics really stresses that all babies sleep alone in their crib, without stuffed animals, without pillows, and on their back. By doing this and adhering to this, this has significantly decreased the incidence of SIDS, or sudden infant death syndrome. Okay,
well, Dr. Moore, thank you so much for being with us. We appreciate all your insight. Yep. And next time on Ask the Expert, we are taking your legal questions. Remember, you can always email us your